Hip Preservation Center here at UCSF treats a variety of hip conditions for a wide range of patients. So it's our goal and our job to help you diagnose, manage, and treat your hip symptoms and help you get back to an active, healthy lifestyle.
When I led the initiative to start the Hip Preservation Center back in 2016, our goal was to bring together specialists to treat the full spectrum of hip injuries. We have grown tremendously over the years, as now we have leaders in the fields of rehabilitation and physical therapy, musculoskeletal imaging, sports medicine, regenerative medicine, pediatrics, and arthroplasty. The UCSF Hip Preservation Center is located at the Orthopedic Institute in Mission Bay. Here we are a comprehensive center that has clinical care suites as well as procedure rooms and OR suites. Further, we also have advanced imaging such as MRI scanners here in the building. And we also have orthotics and prosthetics as well as physical therapy all in one location. We use minimally invasive techniques to help our patients, including arthroscopic surgery for hip impingement and labral tears, endoscopic repairs for hamstring tears, and even endoscopic repairs for gluteus tears.
We also collaborate with our musculoskeletal radiologists to provide specialized imaging services as well as image-guided injections. And we have a wonderful physical therapy clinic as well, and we use all of these resources together to help your hip feel better.
We use the most advanced technology and equipment to ensure that we have the best patient safety and for improving our outcomes. In fact, our outcomes at UCSF are excellent. When we looked at our research here, over 90% of our patients have clinically meaningful improvement after their procedures in terms of quality of life and return to sports. And that is why we're one of the highest volume hip centers in the country.
So for pediatric or adolescent patients, we often collaborate with our colleagues in the pediatric orthopedic realm in order to treat childhood or developmental hip conditions.
My name is Dr. Ishaan Swarup. I'm a pediatric orthopedic surgeon here at UCSF. I take care of children with musculoskeletal problems and with a specific focus in hip preservation. I see patients with hip disorders, which include things like dysplasia and Perthes disease. I think that there is something very special about being able to offer care to a child in need, and I think that's something that I am very fortunate to be able to do every single day that I come to work.
At a children's hospital, many children's hospitals, they have a cutoff of age. That doesn't happen here. I see my patients all the way through. I've been working long enough at UCSF, 2 decades now, that I have adult patients and I continue to see them. So at least patients can be comforted by that continuum that if they come to UCSF, they won't have to go to some strange place that is different, that doesn't know them, and start up all over again. They come to us and they can stay.
It's our goal to help coordinate your care, help steer you in the right direction, and educate you about your condition and potential treatment options. I see a lot of patients who have had hip pain for a really, really long time, years or even decades, and they've had other providers kind of struggle to help them diagnose their problem. And it's really satisfying to me when I'm able to help tell patients that exact cause and then help them get on the road to recovery.